Hip arthroscopy is a procedure that in the history of orthopedics we actually have used. However, with the advancement of all the equipment now, this has become a much more easier procedure to do and a much more widespread procedure that can be utilized to help people fix problems that involve the soft tissue of the hip. We've always had the issues with soft tissue problems in the hip, however, we didn't have necessarily the advancement to allow us to do it in a very safe and an efficient manner. And so therefore we now, with the advancement of technology and the different equipment that is available to us, we are able to do this procedure now at a very effective and a very efficient rate to now be up to par with the other joints that we have utilized arthroscopy in the past, which have been the knee and the shoulder. There are a lot of patients that we're finding now as we look at this and the advancement of hip arthroscopy that are very good candidates for this type of procedure that have either labral tears or ligament tears, or simply they've developed an impingement problem in their hip that we can now address from a surgical standpoint without having to make large incisions and deal with this at a more outpatient basis. So one thing that I always talk to patients about when they know their injury is significant or severe or to a point that may require further treatment, I always ask them, how long has the pain been there? How does it affect you during a day-to-day process and also throughout the day? And I always tell patients that if you find that pain is bothering you on a day-to-day basis or it lasts throughout the day, or you find that specific activities seem to really aggravate the pain or make it significantly worse, whether it be in a very sharp manner or a very constant manner, usually that indicates that there's probably more pathology going on in the hip joint that may need further workup and then of course further treatment. The post-op protocol in regards to hip arthroscopy is really determined on what we do once we have the surgery, meaning is it simply we go in there and we clean up any bone spurs or any torn pieces of tissue that can be cleaned up, or is it something where we actually have to fix something or repair something that'll determine their course of being on crutches or limiting their activity. I will say that I tell patients that doing a hip arthroscopy, depending on your problem, you can expect a recovery from anywhere from 4 weeks to 3 months.